Phobic anxiety disorders. Etiology. The cardinal features of phobias are fear and avoidance. The fear is disproportionate to the circumstances and the patient recognizes this. Despite this insight, the phobic patient feels intensely anxious at the very thought of a particular situation. Phobias are classified as specific, simple, blood injection and injury, agoraphobia, social phobia. Specific, simple phobias. Simple phobias can sometimes be traced to a single traumatic incident, such as being stuck in a lift or underground train, being attacked by a vicious dog or having been involved in a road traffic accident. Specific phobias might sound trivial, but they can severely impair performance at work and in social life, e.g. due to inability to travel by plane. Specific phobias include familiar fears of spiders, snakes, heights, flying, thunder. Blood injection and injury phobia. Blood injection and injury phobia can occur after a traumatic medical incident, and is the most important phobia in the hospital setting. Triggers include the sight of blood, injury, or medical apparatus, especially syringes and needles. There might also be excessive fear of contamination. A phobia of diseases such as AIDS might lead to total avoidance of physical contact with other people, repeated medical consultations or multiple requests for HIV testing. These phobias can lead to delay in seeking medical help, refusal to have blood tests, reluctance to submit to any invasive medical procedure. Blood injection and injury phobia is associated with an unusual physiological response. Whereas other specific phobias are associated with an acceleration of the heart rate on exposure to the focus of fear and avoidance, those suffering from blood injection and injury phobia have a strong vasovagal response with deceleration of heart rate and a fall in BP, which could lead to syncope. Agoraphobia. Agoraphobia sometimes follows the occurrence of one or two isolated panic attacks in a public, crowded or confined space. Fear of further episodes subsequently discourages the patient from leaving home. This avoidance behavior prevents habituation and perpetuates the condition. The phobia is reinforced by the conviction that further potentially harmful panic attacks will occur if the patient ventures out again. Social phobias. Social phobias tend to occur in shy and unconfident people, and might be precipitated by an embarrassing incident. Thus, a sensitive person whose credit card is rejected due to a computer error might subsequently be afraid to sign checks in public because of a fear that an anxious tremor will be noticed. Epidemiology. The epidemiology of various phobias is shown in Table 22. Clinical presentation. The phobic patient experiences both the psychological and somatic symptoms of morbid anxiety in specific circumstances. Even the anticipation of those situations provokes anxiety, and this leads to avoidance. Patients may postpone seeking treatment until there is a change in their domestic or occupational circumstances which forces them to seek help. For example, the social phobic may be given the responsibility of making a public presentation, an agoraphobic may lose a relative who used to do his or her shopping, whilst a blood injection and injury phobic might develop severe anemia and need to have laboratory tests. Agoraphobia. Agoraphobics fear and avoid any situation from which escape might be difficult or embarrassing. Agoraphobic people are afraid of leaving home, going into crowded places, e.g. supermarkets, collapsing, having a convulsion or fainting, going mad, being incontinent in a public place, having a heart attack without access to immediate help. Social phobia. Social phobia is the fear and avoidance of social situations, e.g. restaurants, parties, public speaking, and committee meetings. In social phobia, the fear is that others will regard the person as socially clumsy or will notice his or her anxiety-induced tremulousness or sweating. Differential diagnosis. A delusional disorder has to be excluded in both social phobias and agoraphobia. Social phobic people retain insight and recognize that the fear that other people will observe and judge them critically is excessive and disproportionate. They are aware that their discomfort derives from their own self-consciousness. In contrast, paranoid persons suspect that other people regard them with unjustified hatred and malevolence. Both agoraphobic and paranoid people will be afraid to venture out of their homes, but agoraphobics are housebound because they fear their own anxiety and panic, while the paranoid person locates danger in other people's actions and intentions. Patients with dysmorphophobia, body dysmorphic disorder, might also eschew social events and public places. Treatment. Cognitive behavior therapy is the treatment of choice. Complications. Dependence on alcohol and benzodiazepines. Prognosis. Without treatment, phobias tend to follow a chronic course.